side. We already have the discussion over the structure of eye. We discussed about the layering of the eye, okay. We discussed about the glands which is present in the eye, okay. And we also discussed about the lens and the structure of eye and their related, we can say, the pathologies, okay. So today we are going to discuss the, we can say, the how eye is working, okay. In simple layman language we can say how eye is working. We will see about this, okay. So today our lecture outline, see here, first we will discuss about the ocular muscles, okay. I already told you, no, that the oculi word, okay, oculus word, it is used for the eye, okay. The ocular word is a Latin word which means the eye, okay. The ocular muscles means the muscles which helping the eye, they are called as the ocular muscle, okay. Then we will discuss about the ocular movements, understanding, then the visual process, okay, then blood supply of eye and their related pathologies. And I hope you all are fine, well, okay. See, structurally, as you are seeing, the eye is a complex organ. You know, the eye is a complex organ because they have so many layers, okay, and we can say their joinings, okay, their joinings, they are complicated, they are really complicated. But we already dealt with, in a simple manner, we already dealt with the structure of the eye. So first, today we will see the ocular muscle, okay, ocular muscles. Now, as usual, I have a question. The question is, you know that sometimes we have to look, we can say, down, sometimes we have to look to above, sometimes we have to look to the sidewise, the lateral view. How this happen? How this is happen? This is accomplished by the help of, we can say, the ocular muscle, okay. Ocular muscles. These are basically a set of muscles, okay, which help the eye, okay, to adjust and, we can say, to mediate a proper vision, okay. You know that first you see the object, okay, you see the object. Now the rays refracted and they come into our retina, okay. First they come into our the eye, first part, okay, first layering of the eye, that's the cornea. And I already told you that cornea have the refractive power, okay. So it refracts and it goes to the retina, it goes to the retina, and there will be the image formation, okay. There will be the inverted image formation. But you know that retina has a points, okay. The first point, as you seen, that's called the, very good, that's called the blind spot, or we can say the optical disc, okay, blind spot, where all the rays of retina is present except, yeah, very good, it's a cone and rods, they are absent in the blind spot, clearly. Then in the, there are below that, there is a, we can say, the macula lutea region with fovea centralis, we already seen. And here there is a proper arrangement of, we can say, the rods and cones, okay. So lights have to come into this point, the macula lutea. See, diagram still better. Suppose I'm just roughly drawing, this is your eye, okay, these are the eye, okay. And more layering, okay. And there is a internal, we can say, the retinal lining. See, now from the from the object see you've seen this object. Now the rays come into this point, okay, the cornea, and they directed these visual rays into this area. Now if the rays, light rays, if they come into this region, okay, the blind spot region, then there will be a no image formation. There will be a no image formation, okay. So it have come to this area that's called the macula lutea area, okay, where the arrangement of rods and cones is present, okay. There is a we can say arrangement of rods and cones. Now for that, and if the object is far, okay, if object is far, then I have to adjust. This phenomenon of adjustation is called as accommodation. Write down. This is called as accommodation. This phenomenon of adjusting the eye for the near object, for the far object, for the up object, for the down object, okay. We can say the less intensify object. Understanding? These all for seeing the object, okay, and making them to come into this area that's called the, we can say, macula lutea area with fovea centralis, fovea region basically, okay. For this adjustment, this phenomenon is called accommodation. Clear? Understood? So ocular muscles help in the accommodation of eye. Ocular muscle help in the accommodation of eye. Now, once we define the ocular muscles, the accommodations, let's come and just understand the types of ocular muscle. There are two types of ocular muscle, okay. One type we already discussed while we are describing the structure of the eye, but just revise it. The first set is called the internal ocular muscle, okay, and external ocular muscle. Okay. Internal ocular muscles, they are confined only to this area, okay. They are helping to adjust the lens, okay, to dilate the lens, to constrict the lens, to dilate the pupil, okay, to constrict the pupils. They are helping in this, okay. But the external ocular muscles, they are the major muscles, okay. They move the eyeball, the whole eyeball. Sometimes if we have to look above, then it's went like this, okay. See, the eyeball have to come this way. If have to look the upside, then I have to move this side. If down, then this side, okay. If laterally, then this side. These movements are accomplished or done by the help of external ocular muscle. Clear? Understood? Now, my question is, are you able to do it voluntary? Are you able to move the eyeball voluntary? Yes? Very good. You are able to move it voluntary, means they are supplied by the somatosensory nerves, or we can say simply the sensory nerve. So they are supplied by the somatosensory nerves, whereas the dilation of pupil, okay, we can say dilation of cornea, dilation of the ciliaris muscles, they are most of the time they are involuntary. But you can do it voluntary as well, okay. So they are supplied by the autonomic nervous system, okay, autonomic nervous system, that is your sympathetic and parasympathetic nerves. Write down, it is supplied by the sympathetic and parasympathetic nerves. Understood? No problem. Now the internal ocular muscles, okay, internal ocular muscles, if they will fail to work, that lead to the various conditions. Take the one example. That condition is called mydriasis, okay, pathological mydriasis. It is a abnormal dilation of pupils. It is the abnormal dilation of the pupil. Understood? It is the abnormal dilation of the pupil. Result into the, we can say, the shutter, the eyelids, they won't cut off the light while they are sleeping, okay, or while they want not light to come inside the eye, they can't, because of the failure of internal ocular muscle, okay. And there are other conditions called cycloplasia, okay. If the paralysis occurs to these muscles, okay, I won't work properly, okay, or we can say there is a temporary loss of the movement of the eye muscles, okay, basically the internal ocular muscles. So these are the two conditions: mydriasis, abnormal dilation; pathological mydriasis. The mydriasis is a normal phenomenon, okay, by which the pupils dilated itself. But when it's goes prolonged time, okay, when it goes to the prolonged time, then this condition is called as the pathological mydriasis. Understood? Clear? No problem? Now there are three types of intrinsic muscle, starting from the constrictor pupillae. Write down the name of the internal ocular muscle. The first one is constrictor pupillae, okay. Another one is your dilator pupillae, and last one is your ciliaris muscle. These muscles, okay, which hold the lens by the suspensory ligament, these are called the ciliaris muscles. Clear? Understood? No problem. As I told, they are supplied by the parasympathetic as well as the sympathetic nerve of which nerve? Very good. It's a third cranial nerve. Write down, say third cranial nerve. Cranial number third, that is your oculomotor nerve. Okay, they possess, when they come, these oculomotor nerves, when they come to supply the eye muscles, okay, supply the external eye muscles, in the way they joined with the one more nerve, that is for the sympathetic and parasympathetic, that's called the, we can say, western verg. Write down, that is called as the Westenberg Edegger nucleus, or we can say the Edner-Westenfall nucleus. Write down. The parasympathetic branch of the ocular nerve is done by the Edegger-Westphal nucleus. Clear? This Edegger-Westphal nucleus, they given one branch to the oculomotor nerve. Oculomotor nerve is generally a somatosensory nerve. Okay, but on the way, when they comes from the brain region, okay, in the midbrain, they meet with this naughty, we can say, the nerve, that is a parasympathetic and sympathetic, which we don't have our control, okay. They join and they supplied to these three muscles. Constrictor pupillae and dilator pupillae, they are present in the pupils, okay, whereas the ciliary muscles, they are present into this area which hold the suspensory ligament. When they dilate, when they constrict, we can say, when they constrict, then this lens got constrict, okay, and then if they relax, then it gain the normal shape, the spherical shape, okay. This is about the internal ocular muscles. And don't forget about the disease condition. The one is called the mydriasis and second one is called the cycloplasia. Okay, cycloplasia. Now come to the external ocular muscle. This external ocular muscle, as I said, it is a somatosensory. The nervous supply is a somatosensory nervous supply. Okay, so which nerve supply this? There are we can say the three set of nerves. The first one is your cranial number 3. What's the name of cranial number 3? Very good, it's the oculomotor nerve. Okay, oculomotor nerve. Then the another nerve, we can say cranial nerve, which supply the external ocular muscles. They are called the cranial number 4, your trochlear nerve. Okay, 4, trochlear nerve. Then they are also supplied by the another cranial nerve, that is cranial number 6, abducent nerve. Cranial number 6, that is the abducent nerve. Understood? These three nerves, they supply the external ocular muscles. Now the question is, how many types of external ocular muscles we have? Okay, or we can say the how many set of external ocular muscles we have. We have mainly the 2 set of external ocular muscles. Okay, the first set, where I should write it here, the first set is called as straight muscle. The first set is called as the straight muscle. Straight muscles, because they are involved in the straight, we can say the straight kind of movement. They are straight forward. If we have to look down, up, side, okay, lateral view, medial view, they are involved in these 4 kind of view. Whereas there are 2 set of knotty muscles, okay, and they are called as the oblique muscle. Okay, oblique ocular muscles. Now the 4 set of straight muscles, they are named, write down. The first is called as the external ocular muscle, not this external, we can say the external rectus muscle. External, write down, external rectus muscle. Okay, then you have internal rectus muscle. Okay, then you have inferior rectus muscle. Then you have superior rectus muscle. And about the oblique, it's a superior oblique and inferior oblique. Write down the 2 types of oblique muscle is superior oblique and inferior oblique. Okay, let's summarize it. We are discussing the ocular muscles. Okay, and we seen that I have to adjust for better image formation, or we can say the right image formation or actual image formation. I have to adjust, and this adjustment phenomenon is called the accommodation. So for accommodation is accomplished by the help of some ocular muscles. The first one is called the internal ocular muscle, second one is called the external ocular muscle. The internal ocular muscles, they are basically supplied by the vasomotors. Okay, vasomotor nerves, or we can say the autonomic nerve supply. Okay, sympathetic and parasympathetic, both the branch, generally by the cranial number 3. Understood? And if there will be a problem in this internal ocular muscle, if there will be a paralysis, then the condition is called the cycloplasia. Okay, and if there is a failure of the ciliary muscles, then the condition is called the mydriasis, a dilated pupils, pathologically dilated pupils. Okay, then there are 3 set of internal ocular muscle. The first one is called the constrictor pupillae, second one is called the dilator pupillae, and third one is called the ciliary muscles. Okay, and these vasomotor nerves, they are originated from the Edgar Westphal nucleus. Okay, Edgar Westphal nucleus. Now come to the external ocular muscles. These external ocular muscles, they are supplied by the somatosensory nerves. Okay, how many kind of nerves are involved? There are three kinds of cranial nerves. They are involved. The first one is called cranial nerve 3, which is your oculomotor nerve. Then there is a cranial number 4, that is a trochlear, we can say trochlear nerve, and there are the cranial number 6, that is your abducent nerve. The external ocular muscles, they are divided primarily into the two types. The first one is called the straight muscle, and second category is called the oblique muscle. In the straight muscle, there are four muscles: the external rectus muscles, internal rectus muscle, okay, inferior rectus muscle, and superior rectus muscles. Okay, and then you have the oblique muscles, which is a two types: the superior oblique muscle and inferior oblique muscle. Understood? Any doubt? No? Move ahead. Yeah. Now we will see the movement of eye, or we can say the ocular movement. Understanding? Now we will see the ocular movement. The movement, understanding the movement of eye is very necessary, because there are diseases, okay, there are diseases in which there will be a failure of these muscles. Okay, so for establishing a right clinical judgment, these muscles have their own importance. Okay, these muscles have their own importance. Now come to the ocular movement. First, I should depict the structure of eye and how these muscles are present. This is too long. Okay, and here is your ciliary muscle. Okay, these are the iris, the pupils, cornea. Okay, and they are held by the suspensory ligament. Okay, clear? No problem? Are you able to identify the structures? Yeah? Okay. So the muscles which is present in the eye, they are arranged like this. The first muscles is your superior oblique muscle. Superior this is your superior oblique muscle. Superior oblique muscle. Clear? Understood? Superior oblique muscle. Their insertion is here. They are inserted here. Understanding? Then superior oblique muscles, then superior rectus muscles. It is inserted here. This is the superior rectus muscle, straight muscle of external straight muscles. Okay, then there will be a inferior. Okay, first there is a lateral. should change the color. This is the lateral muscle, lateral rectus muscle. Then there will be inferior rectus muscle, inferior rectus muscle. Okay, how many? 2 to 4. 2 are left, okay, and one is, it is like one is present outside, okay, inward, they are present the inward, but one I should show it. It is your inferior oblique muscle. Inferior oblique muscle. Now this is the, we can say, the set of the external rectus muscles which are held on the eye, which hold the eye. Now there are the movements, okay, there are movement which is accomplished, we can say, which is done by these muscles, okay, done by these muscles. The first movement is the adduction, abduction. The first movement is the abduction, okay, clear? Now these abduction are also called as the lateral movement, In this movement there will be a contraction of this rectus muscle, okay, rectus muscles. Abduction means away, okay. Suppose this is the axis, okay, this is the visual axis, or we can say this is the basis. Then there is an eyeball, if they will move like this, okay, far from the internal, we can say the canthus, they will move away, then this type of movement is called the abduction. And here there will be a contraction of lateral rectus muscle, okay. Right now it's also called as lateral movement. Okay, it is done by the lateral rectus muscle. Okay. Now the another kind of movement is adduction. This is abduction or lateral movement. Now another one is the adduction. Now in the adductions, the movement, there will be a contraction of internal, or we can say the medial rectus, okay. Internal or the medial rectus, Write down, there will be a contraction of internal or medial rectus, which is not shown in this diagram, okay. Now I have to move inward, okay. First is the outward movement, which is done when these muscle, okay, they contract. Eyeball will move like this, okay. And if there will be a movement of inward, okay, inward movement of eyeball, then there will be a involvement of, we can say, the contraction of medial rectus or internal rectus. This internal rectus is not shown in this diagram because they are present in the opposite side of the eyeball, okay. So this is the adduction. Then there will be other movements like the elevation and extorsion. Then extorsion, okay. These are the ocular movement. Apart from that, eye is sometimes performed, we can say the both eyeball is in the same movements, okay, like you are looking down, both the eye down, looking above, looking side, lateral, okay, medial. This is called as a conjugated movement. Conjugated movement. Then I will sometimes perform also the separate movement, okay. This is called unconjugated movement. Unconjugated movement, understood. Then sometimes we have to follow the object. If the object is running on, if we see in the running movie, or we can say that someone is running, okay, this type of movement is called as the pursuit movement. Write down. 7 is called pursuit movement, okay. So these are some of the movements that's called the ocular movement, which is performed by the eyeball, okay, to see the object clearly, and we can say make the right image, okay, make the exact image or right image. Understood? No problem. About, we can say, the nerve supply. About the nerve supply, the superior rectus, they are supplied by the cranial number 3, okay. Superior rectus, they are supplied by the cranial number 3. Then the superior oblique, this is superior, they are supplied by the cranial number 4. Superior rectus muscles, they are supplied by the cranial number 3, okay. Then lateral rectus muscles, they are supplied by the cranial number 4. They are supplied by the cranial number 6, that is abducent nerve, okay. Then inferior rectus is supplied by the cranial number 3, okay. Then inferior oblique, they are supplied by the cranial number 4. So once again, let's define the ocular movement. Ocular movements are those movements which is performed by the eyeball to seeing the object, okay, and adjusting the eyesight, adjusting their, we can say, like sometimes what happened, you see the objects, okay, but seeing the object is not only the one phenomenon of the eye, okay. Seeing the object is not only as a whole. We have to also define sometimes the fine things, like we can say the structure, okay, with shape, as well as the gradient of intensity. Like when you are enters in the room, okay, you are suddenly enters from the bright light to the dim light, understanding. Then I have to adjust, okay. On that time your eyeball, basically this part, the pupils, okay, they constrict. Are you following? They constrict, okay. So these all kind of adjustment, okay, or we can say the visual acuity. These terms denote to seeing the fine details of the object, These visual acuity, they are done by these ocular movement, or by the help of external oblique muscle as well as the internal oblique muscle, okay. We define the movements. The first is abduction, adduction, elevation, extortion, conjugated movement, unconjugated movement, and pursuit movement, okay. Then we defined their location of, we can say, the insertion of these muscles, okay. The superior oblique muscles, they are supplied by the 4th cranial nerve, cochlear nerve, basically. The superior rectus, they are supplied by the oculomotor nerve. Then lateral rectus, they are supplied by the abducent nerve. Inferior rectus, they are supplied by the cranial number 3, and the inferior oblique, they are supplied by the cranial number 4. Understanding? Any doubt? No? Okay, like don't feel these are complicated, okay. You have to read it again and again in order to learn the movement, or we can say the ocular movement of eye. Understanding? No problem. Have patience. have patience now. Once we define the ocular muscles, ocular movement, now come and